Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, we are discussing managing pediatric anxiety with Dr. Krystal Lewis. Dr. Lewis is a clinical psychologist with the section on Development and Affective Neuroscience at the National Institute of Mental Health. Welcome, Dr. Lewis.
Yes, thank you so much for having me today.
My first question for you is, what made you interested in focusing on pediatric anxiety within your career path as a clinical psychologist?
Well, I love helping kids become more confident and face their fears. There isn't just one experience that stands out to me that got me interested in studying child anxiety. However, I will say, reflecting on my experiences, I was always drawn to kids who were a little more reticent and needed more encouragement to participate in activities and in groups. I used to work a lot with kids when I was younger. And as I learned more about psychopathology and became more involved in school-based mental health, I'd applied to graduate programs and once accepted to work with Dr. Thomas Olendick, who was my advisor. He's a distinguished professor of psychology at Virginia Tech. I fell in love with clinical research on anxiety. As a graduate student, I worked with both kids with fear and anxiety and kids with behavioral difficulties or externalizing disorders, but really just had a preference for the internalizing disorders clinically and also research-wise.
Wow. Has the pandemic impacted pediatric anxiety, and what are some of the emotional or psychological changes that parents might observe in their children during this time? What are your thoughts on that?
Yeah, so the pandemic has impacted mental health in a variety of ways. We've seen increases across the board in child anxiety and mental health difficulties during this time. Kids have experienced a significant disruption to their lives as well as adults. And this doesn't only include their schooling, but many kids have missed celebrating milestones such as graduations, proms, sporting events. And we know that kids gain confidence through mastery experiences that often occur when they're involved in these activities, sports and music, being in school. And although many kids have continued some of these activities virtually, it's still not the same. And so they aren't quite able to develop social relationships and have those same positive interactions with teachers and coaches. And so with parents, what we say is parents may observe changes in their child's behavior, including more oppositionality, sleep difficulties. They might notice their children being more clingy or even noticing some regressive behaviors.
Wow.
Kids are stuck at home, they're missing their friends, they're feeling isolated, and may experience challenges with their daily functioning. And so we see that children might exhibit more fear behaviors, more anxiety, worry, agitation, and just more emotional outbursts, which is pretty normative during this time. And we know that the signs of stress and mental health challenges aren't the same for every child or teen, but there are some common symptoms. And so we say it's important for parents to be on the lookout for lasting behavioral and emotional changes that impact the child's functioning.
So, when we talk about pediatric anxiety, what are some of the risk factors and how might those be altered by the pandemic?
There are a variety of risk factors for anxiety, which we'll say include biological factors such as genetics, neurobiological influences, certain medical conditions, temperament, which we say in young kids is being behaviorally inhibited. So you have those biological factors along with environmental risk factors such as stressful life experiences like what most of us are experiencing now with this pandemic, parenting behaviors, modeling. And so what we know is that these factors taken together, the biological factors influenced by environmental risk factors, can potentially put a child more at risk than other children who may not experience some of those risk factors. When considering the pandemic, children are spending more time with parents who might be exhibiting more anxiety themselves or engaging in what we call over-control parenting, over-control behaviors. And for children who are in less stable environments, they might have exposure to more negative experiences in the home, outside of the home, lack of resources, which can also increase risk. And there may be fewer opportunities for stress relief in general for children and adolescents who are in an environment that's not so supportive. And so we think that the combination of, again, the environmental factors and having a biological predisposition contribute to the development and maintenance of anxiety disorders in general.
Wow. What are some of the range of emotions that adults and children and adolescents have been facing during this pandemic? Can you speak to that a little bit?
Sure. I think it's largely important that people understand there are no right or wrong ways to feel during this time. Every emotion is valid, and it's important that we acknowledge the range of emotions that come with challenging situations. Most commonly, people likely experience anxiety and worry, especially at the start of this pandemic, as we had limited information on the virus and things seemed to change so quickly. For some, this anxiety continued to last, as we still don't have a clear answer as to when things will seem a little more predictable and when things might shift in terms of how we're operating. For some individuals, they might experience fear and anxiety about COVID itself, getting COVID. They might feel anxious about their family members or their children and getting COVID, and that's a very common feeling. Many children, teens, and adults have experienced periods of sadness and frustration, as noted before. There was a loss in a lot of our daily functioning and normal activities. Mm-hmm. And common emotions are irritability, feeling lonely, feeling tired or exhausted, and also feeling burnt out. Everyone may have a different experience, but it's very common to see a range of these emotions during this time.
Right. I think it's really important to be aware of that, and maybe just having more open communication is important during this time. And with that, my next question is, how is the role of communication and really validation of emotions helpful, especially when it comes to children?
Yeah, so talking about emotions and how we feel teaches children to name their emotion and gives them a language. It allows them the freedom to experience their emotions as they come. And I think this is very important to teach kids. When we validate emotions, in doing so, we're telling children that it's okay to be angry or sad or scared. And we're helping them to name the feeling and sit with it, but also teaching them appropriate ways to manage those emotions. And so what we do when we're angry or sad or scared, we talk about that with children. I think it's important for parents to model that and demonstrate that. And when parents and other adults talk about emotions and use that communication, it makes it okay for kids to talk about how they're feeling. And so we always encourage parents to allow space for emotions, all emotions. And we don't want kids to feel ashamed for having any feeling, whether it be an extremely positive emotion or something that's more difficult for them. We want them to really learn to acknowledge the emotions, be able to identify how to regulate emotions when necessary. So I think in general, communication is essential, but also there's modeling and showing kids what to do with those emotions.
And that really takes me to my next question, which is, how much can emotional intelligence and emotion regulation play a role in managing anxiety? These both seem to be skills that I would say even adults struggle with. So especially when it comes to the topic we were just talking about with communicating better and being able to regulate those emotions, I can imagine it must be particularly challenging with children.
I think you're spot on with that. Emotional intelligence, being able to regulate emotions, really can impact one's ability to manage their anxiety. You need to be insightful of your feelings and know when and what makes you feel particular ways. And emotional intelligence, how we define that essentially, is the capacity to be aware of these different emotions, express them and control them in appropriate ways. And having good emotional intelligence helps us to navigate relationships with ourselves as well as interpersonal relationships. So without this awareness, it's going to be very hard to regulate your emotions when you're unable to identify what you're experiencing and why, what might trigger your anxiety. And so when it comes to anxiety, having awareness of how your anxiety manifests is important, and knowing when you feel anxious and how you can regulate those feelings is key to managing your anxiety. And so it's no different with children and adolescents. We teach these same skills and helping them to become aware of the symptoms of anxiety in their body and how it manifests for them behaviorally, what they do, and giving them skills so that they know what to do and how to manage those strong feelings of stress and anxiety that they might experience.
That's great. That really is. And that also leads me to my next question, which is that I know that your research has focused on understanding the mechanisms that underlie the effectiveness of cognitive behavioral therapy, or CBT. How does CBT help prevent anxiety and ultimately help to increase resilience?
Yeah, so cognitive behavioral therapy, otherwise known as CBT, it's a type of therapy based on the idea that how we think and act both affect how we feel. We focus on teaching children to understand how their thoughts, feelings, and behavior are all related. By changing how we think, which is often in unhelpful and distorted ways, and changing our behaviors, which are often avoidance-based and unhelpful, we can change our anxiety or other feelings. So the ultimate goal is for kids to unlearn this avoidant behavior. A large part of CBT for anxiety is exposure therapy. This is where we teach kids to face their fears. Exposure therapy is structured practice where kids are in situations and around things that scare them. And they learn that by being around these things, what they thought would happen, which those are those scary thoughts, likely doesn't happen. And even if it does, they can handle it. So the ultimate goal is to increase their general efficacy and their ability to manage and tolerate uncomfortable feelings such as anxiety. So CBT can be quite effective in that way.
That's great. And I found your research really exciting and really interesting, and I think so well needed, especially for this population. Some of your most recent research focused on a very important mechanism for the effectiveness of CBT in children from 8 to 17 years old. What is self-efficacy, and why is it so important for managing pediatric anxiety?
Yeah, that's a great question. Generally, as I mentioned before, I'm interested in building confidence in children. And self-efficacy is a concept that was coined by Albert Bandura, a well-known psychologist, and it's based in social cognitive theory. It's been around for a long time. Self-efficacy is a person's belief in their capacity to exercise control over things that affect their lives and their general well-being. So we know that self-efficacy is the foundation for being motivated, accomplishing things, and general resilience. And oftentimes, anxiety is paired with a belief that you can't handle things that are going to happen. There's a fear in not knowing what is going to happen because how can you prepare for the unknown? If you don't prepare, the outcome will be negative. And so with this mindset, individuals can become very anxious about many different things because we know that many things in life are uncertain and unpredictable. So for individuals with anxiety, lack of self-efficacy may translate to an inability to tolerate or deal with anxious feelings in general. So it's feeling uncomfortable with the unknown, and then feeling uncomfortable with anxious feelings or uncomfortable feelings because there's not a belief that you know how to manage these feelings or manage difficult situations. So this concept is very important in managing pediatric anxiety because in treatment, we utilize CBT and have kids engage in exposures, as I mentioned earlier. And these exposures help to build general efficacy or confidence for children. Mastery experiences, doing things that are perceived to be hard and difficult, builds one's confidence in themselves. And so in addition to that, CBT helps kids to realize that they can manage and tolerate these anxious and uncomfortable feelings. And self-efficacy and perceived control is one of these mechanisms that we believe contributes to therapy effectiveness because within the CBT, within the therapy, they're learning that they can control some of these situations and manage the scary feeling.
Right. And I think, isn't that sort of the beauty of CBT, that it's something that the patient can incorporate themselves and that they can be empowered themselves during periods of time without the therapist?
Exactly. It's skill-based. So we're focusing on teaching these specific skills that clients and patients can use when they're out on their own, when the kids are in school. So they're learning strategies to deal with stressors. And so it goes beyond, we'll say, the traditional talk therapy of coming in and talking about something that's bothering you. talk about it, but then now we're also learning skills so that we can increase confidence and individuals feel confident to handle different situations.
That's wonderful, especially during this time. I feel like that's so needed. What types of role modeling can parents do to try to foster a healthy environment and prevent pediatric anxiety, especially during this time?
Oh, that's a great question. Parents in general, we know, play an important role in helping kids manage their emotions. And oftentimes, parents are children's first role models. So there are specific strategies that parents can use to help build up their child's general resilience. And then also in terms of preventing anxiety, there are specific tools that they can use. I would say, and I mentioned this before, with using emotion language around children, teaching them to label emotions and explain when and why they're feeling a particular way. And so specific to anxiety, it's important that parents can model this behavior. So if you're feeling nervous about a presentation at work, you can use that language about feeling nervous about it and model how you handle that nervousness or that anxiety. We encourage parents to also foster independence in their kids. So allow children to make decisions and do things independently when appropriate, what's developmentally appropriate. But it's important that there are opportunities for independence so kids can learn confidence. They can learn general confidence in themselves and their decisions. We also encourage parents to make sure that they're promoting a sense of safety and control for the child. And so help kids know that they're safe and that parents are there to protect them, but balancing that with giving them opportunities at each age point to take risk and be in control. So there's that balance there that we really work with parents to ensure that they're not being overprotective or doing too much over accommodating for their children. And also, though, that they are providing a safe foundation for their kids. And especially during this time, during the pandemic, we say it's really good to practice good self-care to model stress management and taking care of you. So not only do parents need to do this for themselves, but allow children to have, we'll say, a self-care day, having a day off from school or when they need time to themselves. We want to make sure we're promoting good mental and physical health. So we talk to parents, and if parents are experiencing significant anxiety, they should get connected with a therapist who can help them manage their symptoms. This is very important as we know that anxiety can affect parenting as well. And so in terms of preventing pediatric anxiety, we say we want parents to take care of themselves as well as doing things for their child.
Wow, I think that's so powerful. Why is self-compassion so important during a difficult time like this past year, or any time that someone is experiencing high stress or anxiety? And then a follow-up question to that is, how can we help children to understand self-compassion?
That's a very good question. Self-compassion really helps one to be resilient and manage strong emotions that we all experience. When we learn that no matter what, we all fall short of perfection, we can accept our shortcomings and our strengths and accept ourselves for who we are. Essentially, that's self-compassion, right? And so it's recognizing that we aren't perfect and things may not always go as planned. We may have bad days. And so it's important during times of high stress, especially, that we may not be getting the work done that we planned. We might be off schedule. We might feel tired and stressed and experience more days when things just aren't going great. And if we're aware of when we're placing many expectations on ourselves and those around us, our families, our children, it's during these times that being patient with ourselves and practicing self-compassion that can help us to endure. We want to model this for our children as well. We know that if you're able to be compassionate with yourself, you can also extend that compassion to those around you. So as parents, you want to help your children understand self-compassion by modeling what it looks like, saying kind things to yourself, highlighting your shortcomings, and focusing on how you're handling mistakes. Point out your mistakes, allowing children to see these things, but then also noting when parents are warm and understanding towards their kids when they make mistakes and they may not be performing the best of their ability. This can teach kids to be compassionate with themselves as well. So how parents respond to them is likely how kids are going to respond to themselves. And so if we can encourage kids to be compassionate towards siblings and friends and in general just use positive self-talk at home and outside of the home. We teach affirmations as well. We all like affirmations, but I can do hard things. We all make mistakes. I know be better next time. These are all encouraging statements that increase efficacy and competence. And so it's a good way for parents to teach their kids how to be compassionate towards themselves as well as others.
That's great. That's wonderful. How can clinicians and patients get connected to research studies at the National Institute of Mental Health?
So we recommend that individuals go to our website, which is www.nimh.nih.gov/research. And then they can see some of the research studies that we have going on we have our pediatric mood and anxiety research, as well as all the other different research that's being carried out. On the website, there'll be phone numbers to call and emails where you can send an email of interest as well. I would recommend the general site for all clinical studies, which is going to be clinicalstudies.info.nih.gov. So the best way to find out what we're doing would be to go to these websites. You can do a general search online as well, and then calling the numbers to get more information about the studies, about how to participate, and anyone can participate. That's great. Thank you for sharing that with us. So my final questions are, what resources would you be willing to share with us that could help manage anxiety for both adults and children? And are there specific apps that you think are maybe more appropriate or helpful for children or teens? There are a lot of resources that are out there nowadays, especially books for parents, books for children. I think a few books that I can recommend for youth with anxiety would be one called Outsmarting Worry, an older kid's guide to managing anxiety. And the age range essentially is about 8 to 13 for that book, but it has a lot of the principles of the CBT that I had mentioned earlier. And it's an easy read. It really helps kids understand worry and how their brains operate when they're anxious, and also gives strategies on things to do with that anxiety. There's another book, Rewire Your Anxious Brains for Teens, which is also a very good one, where it provides a lot of information about what's happening in our bodies and our brains, and then provides cognitive behavioral techniques that kids could use. There are several workbooks that are out there, depending on what type of anxiety the kids or teens are dealing with. The Shyness and Social Anxiety Workbook. For parents, there are some great books called Helping My Anxious Child, You and Your Anxious Child. There are a lot of books for parents to learn some strategies that they can use, as well as how to help their kids who have anxiety. I would say also there are many good websites to go to, ours included, for the National Institute of Mental Health. There's the Anxiety and Depression Association of America has wonderful information on that website. Then there's anxietybc.org. That is an interactive site that has a lot of information for parents, for adults, for teenagers, worksheets that they can use, and videos. So I think there are a lot of ways to get information about anxiety. And then specifically, you also asked about apps. There are several meditation apps that are out there, and at this point more well known, that work for kids, teens, and adults. There are meditation apps called Headspace. Okay. There's the Calm app. Is more known. This one called Shine app is really good for adults with maybe anxiety and just stress in general. Another one for kids would be Stop, Breathe, and Think. So there are several different apps that have been developed. And again, I would say you would do some research online just to see how well these apps have been developed. Because what we say is there's not a lot of research that indicates these are valid apps. And what I mean by that is they can be helpful as a tool, but do not take the place of therapy, working with a therapist by any means. Absolutely. Well, thank you so much. This was such great information, and thank you for sharing all of this with us. And thank you for being on our show. Of course. This was such a great opportunity to talk about what I enjoy most, just in terms of treating anxiety. So I appreciate the invite. This episode was brought to you by NEI Membership. The 2021 NEI Synapse Virtual Half-Day Series is included with NEI Membership. Become a member today so that you can register for free for any or all of the monthly half-days, in which Dr. Stahl and colleagues will spend
the last Saturday morning of each month, sharing cutting-edge research and clinical insights on the topics most relevant to real-world practice. Don't miss out. Become a member today. Visit www.neiglobal.com to learn more.